Good morning or good afternoon, depending on when you're watching this. My name is Peter Wareham. I'm one of the physios at the Wessex Rehab Centre, and I want to talk to you today about sleep and pain. So the aims of this session to appreciate the importance of sleep to health, to understand normal sleep, to look at the different things that can affect your sleep, hopefully to learn some techniques to improve your sleep, to reduce anxiety about sleep difficulties, hopefully to get a better night's sleep, and to help manage your pain with better sleep. So why is sleep important? Why are we talking about this? Well, it's estimated that between 50 and 90% of chronic pain patients report severe sleep disturbance. Now, the variety there is to do with different research that's been done, but whatever way you look at it, that's a lot of pain patients that are having problems with sleep. Sleep is defined as behavioural quietness, inactivity that is accompanied by closed eyes, usually a recumbent posture, but possibly not for patients with pain, limited muscular activity, and reduced responsiveness to sensory stimulus. And lots of things happen during sleep that are actually quite helpful if you're in pain. So your muscle activity decreases, your blood pressure and heart and respiratory rate drop, and levels of some of your hormones like cortisol, adrenaline, noradrenaline drop. However, some hormones levels increase, such as prolactin and melatonin. Now, if you remember back to your explain pain sessions, quite a few of those systems that slow down actually speed up when you've got pain. So if we can work on your sleep, that might help to manage your pain. Sleep is important for cell growth and repair, memory and learning, metabolic, hormonal and appetite regulation. Again, things that can help with your pain. So hormones seem to be quite important with sleep. Your sleep is regulated by hormones that respond to changes in light. So they respond to daytime and nighttime. And in fact, if you go outside and get lots of sunlight, receptors in the back of your eyes monitor this, and this releases melatonin. So you get a build-up of melatonin. It's also released when it's dark, and it makes you feel sleepy. So a mixture of light during the day and dark at night will make you feel sleepy. Overnight, your cortisol levels gradually increase. Now, cortisol makes you alert, awake, and it'll also make you hungry. So hopefully, first thing in the morning when you wake up, you then want your breakfast and you want to get going and be active. So it's clearly following a cyclical pattern, and that's called your circadian rhythm. Lots of hormones balance overnight. We've already given some examples, but there's lots of others that will balance overnight. And some of these are essential for a healthy immune system, for good memory, and for appetite regulation. So for example, for appetite, ghrelin and leptin are important, and they build up overnight. And if you don't get that, then that can be a problem the following day where you feel hungry and possibly you're drawn towards more sugary foods such as chocolate. Good sleep will enable the body to repair and regenerate cells, and that's about your growth hormone. Prolactin is also important. Your sleep requirements vary according to age, genetics, and availability. So, for example, babies get an awful lot of sleep, teenagers change the time that they have sleep, adults go to a different routine, and after things such as exercise, your sleep requirements will increase. Now, this is a busy slide, and I'm not going to go over all of it, but your sleep is separated into about 5 different sections. There's a first block on the left called non-REM sleep, and then on the right you've got REM sleep, which is your rapid eye movement sleep. It's your dream sleep, okay? You're going through these stages in a 90-minute cycle, and often at the end of this cycle you may wake or stir, and then you'll go into another 90-minute cycle. We used to think that REM sleep was important, but actually we've now realised that all of them are important and they do different things. So, for example, your muscle activity slows in the first section, your body temperature drops in the second, your blood pressure drops and your breathing slows in the third and fourth, and your muscles become more relaxed and tissue repair goes on. And then obviously in the REM bit, you're having a dream state. Interestingly, the proportion of these vary as you go through the night. So, for example, if you were to have an ideal 5 cycles, the amount of REM sleep would gradually increase as you go through those cycles. By the time you get to the last one, you're getting a much bigger amount of REM sleep. So if you don't get a good night's sleep, that does affect what you get and the processes that plays. Okay. What factors can affect your sleep? Now, again, we've got 5 different areas here. So we've got mood-related stuff, we've got physical issues, lifestyle, environment, and medications. A lot of you may have stresses and worries, and we know that that doesn't help with sleep. And we also know that low mood doesn't help with sleep. Again, there's been lots of research around this, and also traumatic thoughts. And again, interestingly, more recently, they're starting to associate chronic pain with a form of trauma. So again, it's almost inevitable with chronic pain that actually you may have sleep issues. Physical issues, so injury and illness and chronic pain don't help with sleep. And the inability to lie comfortably will not help with sleep. Obesity, again, has a similar effect, and pregnancy, so eventually later on, can have a similar effect. And also we know that hormonal changes, such as your menopause, don't help with sleep. In terms of lifestyle, people's work patterns and shift work can make sleep difficult. We know that night shifts are not particularly helpful and have adverse effect on your health. Work and social related stress is one of the biggest causes of poor sleep, and obviously that links in with your mood issues. Exercise. Now, exercise itself can be good, but exercise done very close to trying to get to sleep can be less helpful. It can make you quite pumped up, your adrenaline starts being released, and you haven't had time to let those levels drop. And that's obviously stimulatory, which does not help you get to sleep. Diet, alcohol, caffeine, and recreational drugs can have similar effects. They're all potentially can be stimulatory, which doesn't make falling asleep easy. In terms of environmental factors, having too much light in your bedroom can be unhelpful. If the temperature is too warm, it won't facilitate sleep, and we'll talk a bit more about that later. Noise, excessive noise, and activity from children can make sleep difficult. The bed itself and the mattress might not help with sleep, including your pillows. And a partner, for example, people who move around or snore loudly might not help with sleep. Obviously, medications as well. So opioid, morphine type meds, we know adversely affect sleep. Anti-inflammatories often contain caffeine, which is stimulatory. There are side effects from some of the medications, for example, putting weight on, which don't help with sleep. Inappropriate use of medications, which often we know happens with people with chronic pain, can not help with sleep. And when people are trying to reduce their meds, that again, the changes of that can be unhelpful with sleeping. So what can we do? How can we help you to get to sleep? Well, routine seems to be really key, and all the research and the advice bodies are pushing towards that. So going to bed or trying to go to bed and get up at a similar time or regular time can be helpful. Avoiding, and I'm going to say excessive sleeping during the day. So a little bit of sleep, especially if you've done something like exercise, can be helpful, but lots of sleep during the day doesn't help at night. And establishing what we call a good bedtime routine, and we'll talk a bit more about that. Having a plan to help you fall asleep or to manage waking in the night. And there are those two different types of problems. Some people struggle to get to sleep, and some people struggle to stay asleep. So going to bed when you feel sleepy. Now we talked about melatonin. Melatonin builds up in the body and it makes you feel sleepy. So taking advantage of that feeling, that's the ideal time to try and get to sleep. Avoiding clock watching. So, often people have clocks and alarms by their bed. That can just increase stress levels. So perhaps putting it where you can't see it, and certainly not repeatedly looking at it. Using relaxation techniques or soft music or some sort of distraction to try and lead you towards sleep. Avoiding worries and stresses soon before you go to sleep. So maybe 30 to 45 minutes before you're trying to go to sleep. And maybe if it's helpful, having a pen and paper next to the bed to record those worries or things that you don't want to forget before you go to sleep. And it's amazing how powerful that is in terms of getting it out and allowing you to let go and then fall asleep. Lots of patients have used that successfully in the past. Now, none of these are the one thing. It's a mixture of things that will help. Try and avoid tossing and turning. And if you are going to get up, then get up for a short time. So if you are struggling to get to sleep, it's not good to lie there for an excessively long period of time, because you'll then start to associate the bed with not falling asleep rather than falling asleep. So after maybe half an hour, go and do something else. Leave the room, do something relaxing, and then come back to bed 20 to 30 minutes later and go through your routine again. So you associate the bed with falling asleep and not with not falling asleep. Relaxation techniques. So I've mentioned relaxation techniques, and this does turn some people off. However, there's lots of evidence to suggest that, to show that relaxation reduces anxiety and decreases muscle tension, and that can help with sleep. Remember, pain increases the release of adrenaline, which is a stimulus. Okay, so it makes you alert, it makes you tense, and that doesn't help with getting to sleep. So relaxation techniques can undo those effects. And there are lots of different types of relaxation. So even if you don't like some of them, there may be other ones that you do like. Tai Chi and yoga have similar effects. Again, the evidence suggests that they reduce stress and they reduce your sympathetic tone, your muscle tone, which helps with sleep. Exercise. So again, we've said exercise just before bed is not good, but there is a large body of research, and meta-analysis means they've looked at lots of research and pulled it all together, and it clearly shows that exercise helps with sleep and with pain. It helps with getting to sleep and also helps with staying to sleep, and all the different problems that you have with sleep are helped with exercise. Now, I appreciate that can be difficult when you're in pain, and hopefully one of the other sections, some of the other bits you do will help guide you on that front. It helps to decrease the use of sleep medication, and it helps to decrease the time that it takes you to get to sleep. And I would add to that, exercise outside is particularly good, and that's back to these issues around light. Getting natural light is the strongest form of light, and it stimulates those receptors at the back of your eyes, which will help you feel tired later on in the day and then fall asleep. In a relatively light room, you're still getting 30 to 40% less light than you will outside. Create a sleep-related relaxing environment. Now, it starts by saying a comfortable core temperature. We know that your core temperature, your body temperature, drops by a degree when you're asleep. So actually having a slightly cooler room than you normally have it is sensible. Again, different if you're sharing a bed with somebody, different people like different temperatures, and you've got to negotiate that a little bit. But generally heading towards cool is sensible. Avoid electronic equipment. Now, that's partly to do with blue light, which will keep you awake. It stimulates you. And laptops, TVs, phones often give off this light, but it's also to do with the stimulatory effect of what's on there as well. So for half an hour, 45 minutes before you're trying to get to sleep, try and avoid that. And ideally have a dark as room as you can manage. A comfortable, supportive mattress and pillow is helpful. Again, that's about thinking about how much time you spend in bed, how much money you spend on what you sleep on, and also trying stuff lots before you buy it. Avoid doing anything other than sleeping and physical activities with your partner in the bedroom. Again, so that association is with falling asleep and pleasurable things that actually relax you to help you fall asleep. And establish a de-stressing bedtime routine, as we've already talked about. So the last two things, being aware of what you eat and drink. So we talked about that as the factors that can affect sleep. Trying to eat immediately before bed is not a good idea. Try and give yourself a bit of time for digestion. Avoiding drinks and foods that contain caffeine and alcohol for a good few hours before you go to sleep. Again, so that they work their way out of your system before you try and fall asleep. And avoiding too much volume of drink, because again, that's just going to send you, or likely send you, to the toilet during the night, which won't help with your sleep. Now, medications is a tricky one. So if your medications are helping with you manage your pain and helping you to do more activity, then you may need to weigh up what you do about this. So opiates, such as morphine, and anti-epileptics, such as your neuropathic painkillers, so your pregabalin, your gabapentin, your amitriptylines, they do not help with your REM sleep. So they're not going to help with sleep, but they might give you lots of other benefits. So you have to weigh that up a bit. Stimulants, we've mentioned already, caffeine, tobacco, alcohol, and the anti-inflammatories will make you stimulated, and they won't help you get to sleep. They're not going to relax you. Also, it's worth bearing in mind the literature is quite negative about sleep medication. So if you're being given medication to help you fall asleep, I would be wary of that. I'm not necessarily saying stop it, but the literature certainly isn't very supportive that they're helpful. So what are we looking for with a good night's sleep? It's worth remembering that the research suggests that what you're looking for is to feel refreshed. So when you wake up in the morning, are you feeling refreshed? If you've been out and had quite a lot to drink or had a bit of a party, you don't generally wake up in the morning feeling refreshed. You're still tired. So it's that feeling of habit of being refreshed. Now, you may not get that straight away. You may need to wait an hour or so. That's just different people work in different ways. Some people are very alert when they wake up, other people aren't. But do you feel refreshed in the morning? If you're trying to change your routine, this may take time, all right? So cut yourself a little bit of slack and persevere. Try and keep going with it. It's a bit like trying to do a new exercise. Strength doesn't come straight away. You have to keep practicing it. Any of you who've tried to teach children to sleep will appreciate that it takes a bit of time. You may feel more tired initially, but stick with it, okay? Be aware of your medications. I mean, if it doesn't go well, cut yourself a little bit of slack. This is a process. We're moving in the right direction. We're practicing exercise. We will get there. Now, normally we have this as an open session and patients come into the unit and we can discuss as we go through. Obviously, we can't do that today. So if you've got any questions, go back to your key therapist in your one-to-one session and ask them about it. We do have a summary sheet of the things that you can do. We can email that out to you if you'd find that helpful. So as a summary, sleep is important. It very much works around hormones and balancing out your hormones, and that's a restorative process. Routine is particularly helpful. Stress isn't. Adrenaline and cortisol ramp up when you're not sleeping well. So maybe look at some relaxation techniques if you can find some that work for you. Light and stimulation prior to bed are not good, but during the day they are. Good luck with your aiming to get better sleep.